Hello and welcome to Living Well in Montana. Living Well in Montana is a program provided for you by Living Independently for Today and Tomorrow. Living Independently for Today and Tomorrow is a center for independent living here in Billings, and we provide advocacy services for people living in the southeastern 18 counties of Montana. My name is Tanya Thomas. I will be your co-host for today. And I would like to introduce my colleague, John, who will be your host today. John, welcome.
Thank you, Tanya. So my name is John Robison. I work obviously for Living Independently for Today and Tomorrow. There I am a independent living specialist. I am also an outreach coordinator, along as a community health worker. Today our special guest is Miss Morgan Miller from Yellowstone Health. She is the project director for Resilient Yellowstone with Healthy by Design. No better person to introduce you than you. Tell us about you.
Yeah, thanks for having me. So like you mentioned, I'm Morgan Miller. I'm a project coordinator actually with Healthy by Design. And I'll get into a little bit of what that is later, but just a little bit about me. I'm born and raised in Montana. I've been in Billings for the last 9 years with my husband and love the outdoors, love to hike and bike and read books. Those are my favorite hobbies, and really have always been interested in science and helping people, and so my career in public health and my work with Healthy by Design really blends that together. So I'd love to talk about the project that I'm working on today.
Nice, okay. So yeah, let's go ahead and do that. Please tell us about Resilient Yellowstone and what you do within that program.
Yeah, so Resilient Yellowstone, it's a really exciting project we've been working on for the last year. In a simple term, it's a project to hire, train, and then deploy community health workers within Yellowstone County in order to address the impacts of COVID, those who are most hardest hit by the pandemic, and those who really experience inequities in health and issues and barriers to health. So that's kind of it in a nutshell. And then we also want to build resilience to weather the next crises or emergencies. So that's kind of the basics. And so community health workers, just to give a little background on what that is, they are trusted members of their community, and they help serve and connect people to healthcare and services. They often share lived experience with the people that they serve, so they might have the same culture, language, just really understand what those issues are, and so they're a great person to help make those connections and improve health as well. Oftentimes they can have a variety of roles and a variety of titles. So community health worker is often an umbrella term, and it can be peer worker, health navigator, promotorus. Those are all different names for community health workers, and they can do outreach into the community, give health education. Sometimes they're in clinical settings to do testing or home visiting. So it's a really cool broad range of what the community health workers can do in our community.
It sounds kind of as if the community health worker and peer support go hand in hand.
That's what I was thinking too.
Yeah, so with Resilient Yellowstone, we really wanted to partner with different organizations in the community who serve different groups of people who were impacted by COVID. And so that's definitely true that we lined up with some organizations that have similar work already going on in the peer support role. And that's the different organizations that we work with are LIFTT today that we're talking with you guys, Adult Resource Alliance, Big Sky Senior Services, Billings Clinic, the Billings Chamber of Commerce, Native American Development Corporation, Riverstone Health, and St. Vincent Healthcare. I think I got everybody. So we have a lot of different organizations that we're partnering with who hired a community health worker and are helping move this work forward. And just to give a little more background, so our project is funded by the CDC, and then it's housed at Healthy by Design. So that's how those are all kind of connected. So
an off-the-wall question. Resilient Yellowstone, Healthy by Design. The differential.
Yes, that's a great question. So Resilient Yellowstone, like I mentioned, it's a project of Healthy by Design. That's where it's housed, and I'm a Healthy by Design staff member, so I'm a backbone staff, and I coordinate all of the different project activities from trainings to the CHWs working with work sites, just providing support there. And so Healthy by Design, I'll just give a little bit more background on what that is, because some people are familiar, some people are not, but it's a community health coalition that is made up of different partners across Yellowstone County coming together to work on health issues collectively. And so it's sponsored by the 3 health entities in our community: Billings Clinic, St. Vincent Healthcare, which is now Intermountain, and then Riverstone Health collectively. So kind of confusing, clear as mud, but it's a great group of organizations working together to make the healthy choice the easy choice in our community. And so Resilient Yellowstone is just a part of that.
Nice, okay. One of the biggest questions that I'm interested in, so other service providers that you work with other than LIFTT that help people with disabilities, can you name a few?
Yeah, so with our project, we're just, like I mentioned, kind of getting off the ground. We just completed our first year, and now we're into year 2, because we're not on calendar years. But we have worked with MSU Billings to have some trainings about disability and how to navigate that in the workforce. We had a great speaker and presenter that we worked with there. We work with you guys, obviously, and then we work with Adult Resource Alliance and Big Sky Senior Services serve older adults, but often, you know, disability is a part of aging too. And so we serve a lot of different, through our partners, we serve a lot of different populations, but individuals with disabilities are definitely one of our priorities, as well as Native Americans with NADC, lower income populations, and older adults, like I mentioned. So there's a lot of diversity and disability in all of those groups.
So one of the questions that pop up, so Healthy by Design, Resilient Yellowstone, is that strictly in Yellowstone County? And with that said, is there a plan or something in the motion to spread that across the other counties that you know of?
Yeah, that's a great question. So in the name Resilient Yellowstone, yes, we are focused on Yellowstone County just because our funding is focused there. But at the same time, we're also working on a state level. So we partner with the Montana Office of Rural Health in Bozeman, and they are putting together a Community Health Worker Association for Montana that's going to be launching hopefully this month. And that'll also be a website with resources and things that CHWs can use and connect with other community health workers. And so our hope is that that can be a launching point for connections and resources and just growing this momentum across the counties. There are some counties that already have community health workers that were doing this long before we were, so we're pulling on some of their expertise and doing some connections. Mm-hmm.
Okay, I like that. So as you know, here at LIFTT, I'm a community health worker. My coworker, Miss Tracy, is going through the course now, and we're planning on hopefully sending more folks to the course. Do you know when, how often they have those trainings?
Yeah, so the Montana Office of Rural Health, they're the ones who put that Community Health Worker Fundamentals course on. And they do have different kind of timings. It's not like every month or so, but they have some every quarter. So I know their next ones will be starting in January, and we'll have some of our new partner sites having their community health workers go through that. So,
okay. Yeah. If it was up to me, every employee in LIFTT would go through the course, become a community health worker, because here soon the outreach program that we're going to put in effect, going out and talking to everybody within our 18 counties, that'd be a skill that I think everybody should have. It's amazing. Then along with that, I'm thinking even the peer supporters, I would like to see them go through that role as well, go through that course. So that way we can actually utilize them to do the community health work as well. That would be amazing.
That's excellent.
That would be amazing. Okay. So let's say if there's some folks out there who would be interested in the Healthy by Design program, but yet they're not affiliated to LIFTT, they're not affiliated with Adult Resource Alliance, they're just people out there. What do they need to do to contact you and see about signing up for the program?
Yeah, so they can definitely learn more in a variety of ways and get connected with Resilient Yellowstone and Healthy by Design in general. They can go to our website, which is www.healthybydesignYellowstone.org. It's kind of long, but if you just search for Healthy by Design, you can find it. That has all of the different work that Healthy by Design is doing, which is a lot, more than even Resilient Yellowstone. We have all sorts of different things we're working on. So you can go to the website. We have a webpage on Resilient Yellowstone, or they can email me. My email is morgan@hbdyc.org. to learn more and to figure out how they can get involved. So we do have a couple new community health worker openings coming soon, so that's an interest if someone's interested in learning more, or even just checking out our resources on how community health workers help the community. There's a lot of great data behind how effective they are in improving health outcomes and things like that. So that's a great way to get involved with Resilient Yellowstone. And for Healthy by Design, we also have a great e-newsletter you can sign up for on our website that gives a bunch of updates monthly on what we're working on and what's coming down the pipeline. And then we also have a Facebook page, so lots of updates go there.
I know that here very soon, we're going to have a link to the Healthy by Design on our www.lift.org website. So that way any viewers, any people going there to check it out, see your link. And hopefully we're going to also be able to expand the community health worker information on that page as well, which is something that I'll be leaning on y'all with to help us out with, because we're trying to make the program bigger and better here at LIFTT. Slow steps, baby steps, you know what I mean? So if you can, and I know this is kind of a rough one for you, but if you can, where do you see the program for Healthy by Design for Resilient Yellowstone going in the future?
Yes, that's a big question, but a great one. So I'll start with Healthy by Design. How about? That's a big one. Since it's a big health coalition, we're doing a lot of things. But right now, we're currently in the middle of our community health needs assessment and planning process. So we did a big health assessment through surveys this year. We do it every 3 years, and that's just a wellness check for our community to see how are we doing on certain health issues. So we take that data and then we present it to the public, and we're doing that at our community health forum on November 18th. It's coming up on a Friday from 11:30 to 1:30 at the Billings Hotel and Convention Center. So
will that be open not only to the community health workers and people within the program, will that also be open for the public to see?
yes, so this
Okay.
it's a public forum, which is great. So we want everybody to attend if you can. Please RSVP because there's limited seating and lunch is provided. But it's a great way just to see what the data is and to give your voice on what you think the issues are that we should prioritize. Because we'll do some prioritization activities, and from there, Healthy by Design, picks some focus areas and comes up with a community health improvement plan, which outlines the plan for the next 3 years. So speaking to the future, we'll be planning that and then implementing that over the next 3 years, and it's where a lot of the exciting work from Healthy by Design stems from.
Nice.
So within that, Resilient Yellowstone is a piece of that as well. So our community health workers were great partners in spreading the word about the survey that we were doing and helping their clients participate so that their voice was heard. I know you were great helping people with disabilities who maybe ran into barriers, helping them work around that to be able to participate. And from there, the project is going to be alongside that planning process on how can we help improve health issues for these communities and these groups of people, and keep working on that. And I think a big part of our project moving forward is how can we make this sustainable in Yellowstone County? How can we help fund it and keep moving it forward, keep supporting the local organizations to do the great work that they're doing?
Nice. Okay. I like it. A couple questions for you that, sorry, I didn't prepare you on here. So one of the programs, or through the Resilient Yellowstone portion of it, we collect all this data for you. Obviously, everybody sends reports to who we helped, their type of disability, other information about it. And so that's a lot of data that's collected and usually submitted towards the middle of the month. With that said, that data that's collected, where does that go? And how is that data used?
Yes, so we just collect some basic statistics on the work that we're doing so that we can see how we're doing and improve. So it's definitely part of a process improvement. And just being with CDC funded, we have to report some of that to the CDC, but it's definitely private and protected.
Yeah.
But it helps us improve our programs and just also see our reach. So we've collected information on how many referrals are we sending out. So connecting people to services that they need, like food and housing and things like that. So it's an exciting way to see how our program is growing and how it's doing, and also to improve in the future.
Nice. If you have any people out there, prospects, I guess you'd say, people who are interested in joining the program, be a CHW or anything of that nature, what do you think are those core competencies that they must have in order to be effective what they do and out there talking to people with or even without disabilities? What do you think those are?
Yeah, I think that's a great question. So I'll answer it for just kind of in general, and then maybe pare down for people with disabilities. In general, I think community health workers, just having that trusted relationship and knowledge of the community and the people you're serving. So having some shared life experiences that you've experienced the same struggles or know kind of the context that they're coming from. And I think being a people person is a part of it. John's a great people person as a community health worker. Just making those connections and just helping people navigate the complex health system that we have, and as well as our community. How can they best live well in this community? And I think for people with disabilities, it's the same thing. Like, what barriers do they experience? How can they help that? Having a community health worker who has a disability or knows how that can be really challenging sometimes to navigate is really helpful, because then they have that trust with that community.
I know that's one of the things that we face when we're out there talking to our consumers. Once again, our clients, we call them consumers. That's one of the things that I've noticed is if you have that close bond or that related subject with them, it goes significantly smoother because you could relate with each other. And so that is an amazing answer. I love that. The next one for you is through the Healthy by Design. I was introduced not that long ago, actually it's a couple months ago, I take that back, to a CERT program. What do you think about that program? First, can you tell us a little bit about that program?
Sure. So as part of our trainings for the Resilient Yellowstone Project, we included CERT, which is Community Emergency Response Team Training. So it trains community members to be volunteers to respond in a crisis or an emergency situation. So they can just be a support to emergency responders. They're not to get in the way, but they're to be there to support. They can help with crowd control or just basic CPR, first aid, that's the word I'm looking for. They know how to help direct people, and they could do, things like vaccine clinics in the pandemic. They could help with some of those admin things, or just be a first response and a volunteer core for that. So that's what CERT is. What was the other part of your question?
The biggest thing is how y'all come play with that. What's your role in that program? I know that I was introduced to it from you. Do y'all organize that? Do y'all plan that? And the next question for that would be through the trainers that were there, because it was amazing training. Where'd they come from? How did you get a hold of them?
Yes, that's a great question. I don't have all the answers,
okay, well,
but I'll give you a little bit. Yeah. So we had it as a training, so we incorporated that into our community health worker training to give them some extra skills to help serve their community. We're hoping to maybe do another training in the future or keep it rolling, but right now it's kind of in a beginner process of where does it live, what does it look like, but the trainers are excellent. We had some through the health department emergency preparedness services and the county emergency preparedness services did the trainings, and the hope is that it would be a community training that other residents could participate in as well. So still in the works, still being figured out, but we definitely wanted to add that into our trainings.
I think that the more people we have involved with the community health worker, more people that we had involved with the CERT, I think that'd be very beneficial to Billings as a whole. I believe that's something that should definitely be in the works.
Right, because even one of the tenets that the training does is how do you take care of your own mental health, or how do you recognize mental health in a crisis, because that's a big thing, people experiencing a traumatic event. And so I think anybody takes it as just good information to be more prepared.
Yeah. And obviously with current events we've had here, for example, the flooding that happened down south, that's that I know that the CERT teams were involved with that. There were CERT teams down there. From what I understand, the work they did was amazing. So hopefully that carries on and get more people involved.
Yeah.
I hope. Okay.
I have one.
Yeah.
Morgan, can you tell us a little bit about, I know that you were going to talk, you said that Healthy by Design encompasses a lot of things. Can you tell us more about what else Healthy by Design offers?
Yes, that's a great question. So,
That's good.
like I mentioned, it's a health coalition, so there's a lot of different organizations working on different health issues and trying to help our community be healthy by design. So making the healthy choice the easy choice for people, and that can look in a lot of different ways. So one of the other initiatives that we've been doing for a long time, is the Gardeners Market at South Park.
I love that.
Providing fresh fruits and veggies to people so they can make healthy choices and have it be affordable. Another initiative that I know we worked on this last year was the Year of Walkability, helping people get outside and walk whatever that looks like for you. It can look like walking as a wheelchair, walking with a cane, just walking with a stroller. Like, there's all different ways to walk and get outside and be active and enjoy connecting with others. So those are a couple examples. And with this next, so the public forum with the data collection, and then after that we do a planning process on what do we want to focus on. A lot of our contents or topics come out of that. So we're going to see how the pandemic affected the data, how our health has changed since there, and then we'll create a plan to address that. So more coming soon on that plan and how we implement that. But there's a lot of great work ongoing. Healthy neighborhoods is another thing that we were working on, helping to make neighborhoods healthy by design and able to support people's healthy choices and lifestyles.
The information for that we just mentioned, like the Gardeners Market at South Park, so on and so forth, is that found on the website by any chance?
Yes, all of the good work we're doing is on the website, so you can
Nice.
look, take a look at all the stuff that we're doing there, and there's a lot of great information.
Can you please go to that website one more time?
Yes, it's a long one, so it's www.healthybydesignYellowstone.org.
Got you. Perfect. Okay. Well, I do believe that my questions are about out. Is there anything else you'd like to add, Ms. Morgan?
I think just keep tabs on what we're doing with the newsletter or the website. Come attend the forum. We'd love to hear your thoughts on the issues and how we can improve health in our community and get involved. We'd love to have you join the coalition and help with the work group.
And you said that forum was on the 18th
Yep, November 18th from 11:30 to 1:30.
at the...
Billings Hotel and Convention Center. Oh,
Perfect.
and I will mention that if you can attend in person, we are recording it, and there will be an opportunity to still participate in that prioritization activity afterwards, because we're trying to make it more accessible.
Nice. And also they could make sure if you're going to go in person, you got to make sure RSVP is
Yes,
done.
that's very helpful. My
Okay.
team will thank you.
Gotcha.
Yeah.
Okay.
I love it. I look like we're going to wrap up. Morgan, thank you so much for
Thank
coming
you.
today.
Yeah, thanks for having me.
You have some wonderful information, and I hope that you get a lot of people that come to the forum.
Thanks, me too.
We will say goodbye for today and join us next time on Living Well in Montana.